Which blood group is known as the universal donor? O. Which blood group is considered the universal recipient? AB. The primary purpose of blood transfusion is to replace blood volume. Which component is commonly transfused to treat severe anemia? Packed red blood cells. Which anticoagulant is used in stored blood? Citrate. What is the shelf life of stored whole blood at 4 degrees Celsius? 21 days. 21 days. Cross matching is done to check compatibility. Which test is done before every blood transfusion? Cross matching. What is the minimum hemoglobin level required for blood transfusion? 12.5 gram per deciliter. What is the total volume of blood in an average adult? 4 to 5 liters. In which situation in freeze frozen plasma FFP used? Clotting disorders. Blood transfusion reactions are most commonly caused by mismatched blood. Which blood component is given to a patient with thrombocytopenia? Platelets. What is the normal lifespan of a red blood cell? 120 din. Which infection is commonly screened for before transfusion? HIV. What is the main sign of a hemolytic transfusion reaction? Hemoglobinuria. What is the first step if a patient develops a transfusion reaction? Stop transfusion immediately. Which IV solution is compatible with blood transfusion? Normal saline. What is the normal blood volume for an average adult per kg? 70 milliliter per kg. Which device is used to prevent blood clots during transfusion? Filter. How long can blood be transfused after taking it out of storage? Within 30 minutes. What is the main function of platelets in blood? Blood clotting. Which blood group can receive blood from all groups? AB. What is the minimum weight required for safe blood donation? 40 kg. What is the main purpose of Rh factor testing? To prevent hemolytic disease in newborn. Which type of reaction occurs due to mismatched blood transfusion? Hemolytic reaction. What is the safe interval between two blood donations? 3 months. Which electrolyte imbalance can occur after massive blood transfusion? Hyperkalemia. What is the normal platelet count in the blood? 1.5 lakh থেকে 4 lakh. For how many hours can blood be safely transfused? 4 hours. What is the recommended needle size for blood transfusion? 16 থেকে 18. Which condition is an absolute continuation for blood transfusion? Severe heart failure. Which vitamin deficiency may occur due to repeated blood transfusion? Vitamin B12. What is the minimum hematocrit level required for blood donation? 36%. Which of the following is used to separate blood components? Centrifuge. Which test is done to detect hidden blood in stools after transfusion? FOBT, fecal occult blood test. What is the main indication for giving albumin? Shock due to low protein. Which of the following blood components doesn't require cross-matching? Platelet. What is the meaning of autologous transfusion? Blood donated by self. What is the normal plasma volume in adult? 3 liter. Which blood group is safest for emergency transfusion when the patient's blood group is unknown? O negative. How soon must transfused blood be compatible infused after starting? Within 4 hours. Why should blood not be stored above 4 degrees Celsius? It causes clotting.